So in the spirit of rewarding those who showed up on time, I say we get going here. And if other folks want to join us, great. If not, they can enjoy a hot, smoky evening wherever they are. So welcome to yet another installation of our All Community Council virtual town hall meeting series, which we have been doing since COVID kicked off last year. Violet, would you like to do a little roll call of who's here?
Yeah, you bet. We have myself, Violet Plummer, Chet Krauser, Chris Lansbury, Cindy Farr, Deshane Barnett, David Strohmeyer, Josh Slotnick, Juanita Vero, Shane Stack, Burt Caldwell, Emily Herndon, MCAT, Rick Hall, and Tom Browder. Did I miss anybody? Okay, over to you, Dave.
Okay, thanks, Violet. And let's just dive right into our agenda. We have 3 special presentations this evening, then our traditional round robin where everyone represented here tonight gets a chance to say what's happening in their community council geographic regions. So Cindy Farr, would you like to give us an update from the health department?
Sure. Unfortunately, I do not have good news whenever it comes to COVID. Right now, we have seen a steady increase in cases that we believe is now the beginning of our next surge. It's been climbing for a couple of weeks, but now it's been going up really significantly the last few days. So about 2 weeks ago, a little less than 2 weeks ago, our incidence was 4 per 100,000 people. And now it's 13. So definitely seeing a huge increase. And the last 2 days, we've had 30 cases a day come in. So definitely seeing increase in COVID activity. We're still getting people vaccinated at slow and steady rates. We're seeing about a couple hundred people a week that are coming in to get vaccinated. And a lot of them are coming in that had some vaccine hesitancy, and they come in and really spend a lot of time talking with our staff so that they can get educated about the vaccine before getting vaccinated. So we do intend to keep, keep our brick and mortar clinic going. We plan to keep doing the mobile testing and the mobile vaccination clinic. We've still got testing occurring over at our Flynn Lane facility. The CDC updated their mask guidance yesterday to include people who are vaccinated and unvaccinated, that they are strongly recommending, specifically because of the Delta strain that is now the most predominant strain in the United States, that everyone wear masks when they are indoors in public places. So that's the gist of what we have for COVID. And Deshane, do you have anything that you wanted to add on that before we take questions?
No, I mean, I think that was an accurate report of where we're at right now, and just highlighting that our best tools against this are still vaccines, masks, and social distancing.
Cindy, before we open it up for questions here, have any of the new cases been attributed to individuals who have already been vaccinated, or a mix of both?
Yeah, it's about 5% of our COVID cases. We've had about a 5% breakthrough rate. So if you look at all of the people who have been vaccinated, about 5% are still coming down with COVID. And we are seeing the Delta strain starting to pop up more frequently here in Missoula County.
Thanks. Well, let's open it up for some questions. Folks have questions for Cindy? Burt Caldwell.
Yeah, Cindy, on that 5% breakthrough, are those ending up in the hospital or dying?
Some of them are ending up in the hospital. I don't think that we've had any deaths that were attributed to a breakthrough case of COVID. Usually what happens whenever people are experience a breakthrough case, so they get COVID when they've already been vaccinated, they do tend to have a little bit more mild form of the illness. But unfortunately, we're seeing a lot more breakthroughs in our older populations, and so they have a lot of other complications if they get COVID.
Yeah, you're not making me feel good with that. I'm one of the older population. By the way, for what it's worth, what I read a couple of days ago was 99% of people that are being tested and coming out positive are unvaccinated. So that's nation.
Yes, yep, that's correct here in Missoula too. The vast majority of people who are getting COVID are the unvaccinated population. So that's part of why we're really trying to encourage people to go out and get that vaccine if they haven't gotten it yet.
Thanks, Bert. Emily?
I'm going to ask it, although I know with the legislation changes and stuff like that on maybe some control issues on mask mandates coming back again. Thoughts, opinions, or don't want to make one? It's okay.
Yeah, I can speak to that a little bit. We, with several bills that got passed through the legislature this spring, our hands are pretty tied as far as what we can require for mitigation. And so what we are doing in response is just trying to get case investigation and contact tracing done as rapidly as we possibly can to try and get those folks out of circulation to help try to slow down the spread. But as far as being able to require mitigation measures like masking or, you know, group sizes or anything like that, we really don't have the ability to do that now.
I suspect if you came to your county commissioners and requested that as a possibility, you might get a positive vote.
That was the voice of Bert Caldwell speaking. Thanks, Bert. Thanks, Emily. Other questions?
Yeah, Cindy, with the clusters, I mean, is there, I mean, is it all ages, kind of all demographics that it's just kind of unvaccinated? That's the underlying, and we don't have, there's not a particular event. There's not, you know, it's across the board.
Yeah, it's pretty much across the board. We haven't identified any particular event or particular age groups or anything at this point. It's just people who are unvaccinated.
Thanks.
Other questions?
Hey, I have one, Dave.
Yeah, go ahead.
Hey, this would be for Deshane. Deshane, are there anything you could think of we could do to increase vaccination rates that we're not currently doing? Or any way we could help both the folks on this call and the BCC?
Exactly. I think one of the best things that we could do right now is get ideas and thoughts from the community, because we've done a lot. Like we have, you know, we've done the mobile clinics, we will go to your home. Lucky's, we're trying not to call it Lucky's, but the mall site is open 7 days a week. You can go in and get vaccinated. You can be in and out. For most people, you know, you're in and out in less than 30 minutes. So we've made it as convenient as possible. We've done all kinds of health education outreach about the safety behind vaccines. And even, when Cindy talked about the breakthrough where we're seeing about 5% of fully vaccinated individuals, it's just under, it's about 4 or something, experiencing a breakthrough, that fits right in with the vaccine efficacy that they reported during the testing was, 95 to 96% effective. So we expected that 4 or 5, but that also means that they really knew what they were talking about. They did their work. These vaccines have been well planned, well thought out. What I would say is we're at a point now where we are willing to take suggestions for how we can hit our goals around vaccination, because we still have a ways to go.
Well, sorry, I also wanted to add that just so everybody knows, our county actually does still have the highest vaccination rates in the state of Montana. We have from, I think, since the very beginning, since they started reporting it out. But yeah, we're always happy to take any kind of suggestions that people might have.
Thanks, Cindy. Well, let's turn it back. Let's punt here a little bit to our representatives from community councils out there. Do you have any thoughts as far as what could help facilitate vaccinations in your communities. Rick.
If you could send a blurb about the increasing cases to Bert, I could get it posted up on Nextdoor. I'm more than willing to get the wrath of people on Nextdoor to at least give them the facts about what's happening with increasing cases. And that's I think a grassroots thing that you may not have access to.
Thanks, Rick. Great suggestion. Tom.
So I know this, I don't know if this is doable, but without jeopardizing personally identifiable information, things that HIPAA covered, is there any way to get a county regionalized update on where cases are coming from? Does it have to be countywide? I mean, you know, let's say legislative district, House District 92. Could we know, like, if there were so many cases coming out of here? Because I think as we, you know, we've got the same kind of local venues, put up posters, 4 or 5 pretty effective, widely used Facebook pages. But is that information we could kind of, you know, extract out somehow?
We've actually been told by our county attorney's office that we're not allowed to break it down even by zip code or anything. It has to only be aggregated data, and so we're not actually able to share that. But I can tell you that the cases that we're getting coming in, they're coming from all over the county. So I mean, it's pretty widespread.
And then I guess related to that, could countywide, and maybe you do this, does the data dashboard have an age breakdown?
I believe it does, but I would have to jump on there and look. I haven't looked at it in a while.
Because in an area like this, I sort of share Bert's thing. A lot of us are sort of in the twilight end of the age spectrum. And I think if we could see some, you know, pretty heavy data saying, wow, it's impacting us, that would help get some of these really recalcitrant folks back to the vaccination line.
Thanks, Tom. That's a good point. It kind of boils down to are there any ways in which we can better focus our outreach or marketing other than just completely blanket? And is there any more fine-grained data that could be used to that would not get anyone in legal hot water? Emily?
Yeah, just anecdotally, so I live in Tura, but my business is out in Plains, Montana, and so I work with a really rural population where I think maybe 30% of the county is vaccinated. And I'm constantly amazed because I live in a very digital world that my information comes that way. But like I had a upfront conversation with one of my patients the other day, and he's like, Emily, is it okay that I've had COVID? Is it okay that I have a vaccine now? And so, and it hit me again that, oh wait, this person, I remind him of his appointments because I remind his neighbor, because he doesn't have a telephone and he doesn't have an internet access and he doesn't have a TV in his house. So, you know, and looking at the demographics of like the vaccinated population, you're looking at the most wealthy people are the most vaccinated, and they're probably the most ones that are getting their Nextdoor, their Facebook, their news reports, their much information. But my people sitting out in Plains and Sanders County, that I have made reminders via post office box and churches for their appointments, that they're not always getting that information. So my information to him was 97% of the people that are in a hospital right now are because of not unvaccinated. He's like, oh, I need to go sign up. And I was like, yes, would you like me to make sure you get your name in so they can call your person? And at the hospital, I can make sure you have your name in. We can do it right now. He's like, yes, please. So it's just, so maybe not thinking just digitally, maybe not thinking there, but I like that Tom said, you know, posting it up, those senior centers, those post office boxes, those other stuff, and hit those people that aren't digital world and aren't having their news on all the time. Just a thought.
It's a good thought, Emily. Thank you. Bert?
Yeah, I wanted to follow up a little bit on Tom and Deshane, in that there was an event out here at the Kettle House in Bonner, and I don't know what you two think, but what I saw was disastrous. People just didn't show up. They won't show up for a beer, you know. I think that this end of the county maybe just needs to be pushed off to the side and go try to vaccinate other people. But anecdotally, I saw something on Facebook the other day where a guy had gotten COVID. He was in the hospital. He almost died. And they asked him if he was going to get vaccinated. And he said no, because there are too many questions about it, and it's experimental. And the doctor looked at him and said, well, all the drugs we use to save you are experimental. So why don't you just go get vaccinated? No response. That's it.
Thanks. Other
Bert.
comments, thoughts?
Yeah, Bert, you can't fix stupid.
That's true.
Oh, hi, Lee.
Hi, I'm sorry I'm late. I was on a phone call.
No, that's okay. We're just getting a little update on COVID and also doing some brainstorming amongst community councils as far as what strategies there might be to help get the word out to folks that maybe they ought to get vaccinated.
You know, if you guys came up with a really good JPEG to have, and I'm saying this to Cindy, if you guys could come up with a really good, powerful JPEG for me to post on our EMCC page, I'd love it. That being said, also, it's because of this that I'm going to stand really firm on not having public meetings with our council here in East Missoula. A, because of the COVID, that I'm refusing to bring people together for health concerns, but also we have lost our public location because of COVID as well. That being said, I'm going to be buying a subscription to Zoom so that we can, I mean, we were piggybacking on one of the churches here in town. We were in our community, we were piggybacking on their account. So we're going to go ahead and have to just buy a Zoom membership. Letting you guys know. That's what we're doing.
Thanks, Lee. Deshane.
But and I'll say too, in the very beginning of the pandemic, actually, my church was piggybacking off of my Zoom account. So that is the Missoula spirit. Like, we just help each other get through however we can. And along those lines, what I want to say is we have brought our staff together to do the traditional, public health approach. We have tried to break outside of the box and think of other ways. What I just want to say is that I am open to hearing any and all thoughts and suggestions on how we can increase vaccination and increase mitigation and decrease the spread of this virus. And we might, we can't maybe do all of these great ideas, but that doesn't mean that I don't want to hear them and at least give it a shot. So
I agree with that. Thank you.
Thanks, Deshane. Thanks, Lee. Rick?
I know my sister puts on Pet Fest and Women's Fair every year, and I think they've got somebody from the health department doing vaccines to promote at Pet Fest this year. So, outreach at things like Out to Lunch and anything like that, even if it's just for awareness, I think you probably already do that. Maybe you could tell us about that.
Yeah, we have actually been doing Out to Lunch and Thursday night in the park, and we've got the Pet Fest event. I forwarded that on to the team, I think today actually, or yesterday. And so we're definitely trying to get out to any events that we know that are going on in the community. We're just seeing not a lot of uptake at those events. We've actually had a lot more people coming by just to thank our staff for what we've been doing, and saying, oh, well, I already got my vaccine. So, but yeah, totally appreciate the suggestions.
Thanks, Rick. Anything else on this topic? Well, a good time to segue is right now to, well, you've already heard from Deshane a bit, but it seems like it's probably time that Deshane formally introduce himself. Deshane is our new director of the Missoula City County Health Department. Deshane, talk to us about yourself.
Yeah, so good evening, everybody. Yeah, so a little bit about myself. Originally from Missoula. My parents split up, so my dad was out in Tura, so I was out Tura Road, and my mom was here in town on Toole Avenue. So I was a North Side kid who became a South Side adult. I'm not one for. This is gonna sound awful considering my job, but I don't want to be around a lot of people. I love Missoula. I love this community. I was born here. I love y'all. I don't want to have to sit behind you in traffic. I don't want to have to stand behind you at a line in the grocery store. So I like living sort of out in the boonies. But that is not the case right now. I live in Franklin to the Fort. My husband and I have a 10-year-old son, and so we raise him. He'll go to Franklin. He's going to be in 4th grade. I graduated from the University of Montana. My freshman year was 1993, and I graduated in 2014. So it was a 21-year trip through University of Montana. And I graduated with my bachelor's, and then throughout that 21 years, that included time in California, in Oregon, Oregon first, then California, then DC, and then came back home. 2013, my dad had a heart attack, and he's fine. St. Pat's took great care of him, but that was just a wake-up call that my parents were getting older, my grandparents were getting older, so I moved home November 2013. Finished my last year that I needed for my bachelor's, because by then I'd amassed all kinds of credits all over the world that we squeezed them together, and I had 1 year to go and did that. I went back down to California to do my master's. So I have a master's in healthcare administration from UC San Francisco. But coming back home spoiled California and basically any city for me. So the first week after I moved back to California to start my master's program, I went to go to Safeway to get groceries, and it took me 20 minutes to find a parking spot. And that's when I just knew. I knew I was not going to stay in California when I finished my program, and I didn't. So I graduated and moved back to Montana a week later. Was working on campus, just doing some adjunct teaching and research. And my background is in Indian health. So when I very first moved to Oregon and then California, it was working in Indian health programs. And then when I was in DC, I was the executive director of the National Council of Urban Indian Health. And so that is my background. And so when I was on working on campus, stayed in close touch with, at the time, Missoula Urban Indian Health Center, and their executive director got tapped by the Indian Health Service to go work at the area office in Billings. And she said, Deshane, we need you. So I hopped over to the Indian Health Center. We changed our name to All Nations, got medical dental services up and going, although COVID put a stop to dental, and I don't know that that's gotten back up and running. But and yeah, so then I was at All Nations for a few years and applied to be the director here, and went through what is absolutely the most intense interviewing process I've ever gone through in my life, and was honored to be selected. And so that's a 2-minute version of my life, and I'm sure there's questions on things that I missed.
Thanks, Deshane. Glad that we were rigorous in our interview process. So, any
congratulations! I'm glad you got the job, Deshane. This is Lee Bridges.
Thank you very much. Yeah.
Questions for Deshane? How has it been so far, Deshane, in your first few months?
There's never a dull moment. I have learned about rabies, about E. coli, about Giardia. Obviously, I knew about this stuff anyway, but not from this perspective and with this much intensity. So, and then COVID's just the icing on the cake. So it's been great.
All right. Anything else for Deshane? Emily?
Yeah, what are you seeing some areas that need some improvement, and kind of like, do you have a direction you think you need to focus on, or are you still just getting the lay of the land?
So the part that I forgot to mention is that, so I was teaching and doing research on campus. They, wanted me to apply for the job at All Nations, so I did. I got that. I was already on the agenda to teach in the fall. So I started at All Nations in June, and then that fall, I was teaching an undergraduate statistics class, a graduate seminar. But on top of all that, and serving as executive director of All Nations, but on top of all that, I had also, because I wasn't expecting Leanne to get called up to Billings, enrolled in a PhD program. So I'm getting my PhD in public health. And was a full-time PhD student for the last 3 years. I just completed, thank gosh, the last of my coursework. So now I'm just doing my dissertation research, and that's, if I weren't talking to all you nice people right now, that's what I'd be doing. That's my evening and weekend hobby. So that was a long way of saying that my PhD in public health is a research PhD, and data is a huge component of the research that I do. And I think it's not that, the department has dropped the ball or not done good with data, but there are lots of opportunities for us to improve data. And so that's one of the first projects that I'm picking up, is working with the UN Center for Population Health on how we do data collection, data analysis, data sharing here in Missoula, not just between the university and the health department, but also amongst the hospitals, our FQs, so federally qualified health centers, that's Partnership Health Center and All Nations Health Center, our social service agencies, Human Resource Council, the POB, et cetera, how we can improve how we report, share, and use data for the betterment of the community. And then, so that being said, the other thing that is really big for me, and I know was big for Ellen also, is the social determinants of health, and in discovering what the health department's role can be in the social determinants of health. So we're talking about issues of homelessness, unemployment, underemployment, undereducation. What role what role can the health department play in informing, advocating, and participating in change efforts around the social determinants of health? So I would say data and social determinants of health are two things that are absolutely on my list of priorities. And then obviously COVID and all the fun day-to-day work also.
Just a quick comment to that. I really like the fact that you're hitting a lot of wide spectrum of different areas and getting the research out of there. That's fascinating. So good work.
Thanks for the question, Emily. Other questions for Deshane? All right. Well, thanks so much, Deshane, for joining us. Thank you, Cindy. I don't know if you guys can hang around just a little bit longer in case any other questions come up, but please do if you can. Let's roll right into our next agenda item. Jamar Galbraith, who's our equity coordinator for Missoula County, is going to share a little bit with us about the JEDI board. JEDI standing for Justice, Equity, Diversity, and Inclusion. Nothing to do with Lucas Studios. So go right ahead, Jamar.
Thank you, Commissioner Strohmeyer, and good evening, everyone. Can you hear me okay?
Yes.
Great. Sometimes I have some issues with my audio, but good evening. Thank you all so much for having me. Thank you all for all the work that you do on behalf of our communities as community council leaders. My name is Jamar Galbraith. I use he, him pronouns, and I'm the equity coordinator with Missoula County, the Board of County Commissioners. I just wanted to chat with you all a little bit today about some of the work related to justice, equity, diversity, and inclusion that we're doing, and also use this as an opportunity to try to learn ways in which we can more intently engage our community councils and our communities in this work. We are in the process of developing Justice, Equity, Diversity, and Inclusion Advisory Board with a primary goal of being able to help identify and define the sort of work related to justice, equity, diversity, and inclusion within our community, and also be able to examine what that looks like within Missoula County. The purpose of this advisory board is to create community-driven interagency advisory structure within Missoula's local government that's comprised of community experts of diverse backgrounds, broad experiences, fields, and experiences, again, in order to align our strategies here. We are in the process of developing that, and one of the reasons why I am excited to speak to you all this evening is because it certainly would be one thing to sit off in an office and think of what this would look like for our community, but I don't think that's the correct approach. Instead, what we're doing is we are looking to pull together a development team to help define the advisory board scope of work, help to structure the advisory board, develop and execute the advisory board's recruitment and application plan, and then eventually onboard folks. And so I would love to use this as an opportunity to reach out to see if there are opportunities for us to engage our councils more intentionally and pull us into this work. And finally, just with a little bit of timeline, sorry, I'm shifting screens here. The development team is looking to engage in about 15 or so weeks of work, about an hour and a half meeting at a bi-weekly structure. We've had our preliminary meeting on July 19th. Our next meeting will be next Monday from 1:30 to 3. We have a hybrid meeting. The physical location is the Sophie Moe's room, and there's a Teams link to that as well. And so, yeah, again, our next meeting is going to be August 2nd. And in terms of the process and where we are, our sort of focus is taking a couple weeks to really form and pull the group together to develop that group identity. Take a few weeks to learn city and county system and structures related to advisory boards. The next 3 to 4 weeks or so are going to be around forming the structure, putting together the plans that include developing the bylaws and MOUs, developing that marketing and outreach plan. And then finally, we're looking to fill and have an advisory board seated with the soft deadline of January 1st. And I say soft deadline because I really want to be respectful of folks' time, but I also want us to look forward to us having a seated board by January 1st. And so, yes, that's about all the time that I wanted to take up today. I'm certainly available to answer any questions. And just thank you all so much for your time, and thank you for your work.
Thanks, Jamar. Questions for Jamar? Lee.
Hi, Jamar. I'm Lee Bridges from East Missoula Community Council. Hold on, let me see if I can turn on my camera so you know who I am. I don't know if I'm on there or not, but maybe I am. Anyway, I'm with the East Missoula Community Council, and you said you wanted to involve yourself with councils. At what point in I know that you're just starting up and getting going and everything. At what point do you think you'd like to be able to give a presentation to the councils? Each council, like. In other words, what I'm asking you is, at what point between September and May coming up can I put you down on our agenda and have you come and introduce yourself and your program to our board and our community?
Sure. I'd certainly like to be able to map out a time sometime between May and September. That's a pretty generous window there. So thank you for that, Lee. But yes, why don't we connect? We can look at schedules. And I think one of the good things by looking that far ahead is that, by then it's not exactly even though I'm sort of coordinating and helping to facilitate it, I really don't envision it as like sort of like my program or anything like that. But I would love to talk a little bit about the work that's being done. And one of the things I do want to highlight too is that when it comes to our work around justice, equity, diversity, and inclusion, this is work that's already been done. Thank you again, Commissioner Strohmeyer, for putting the shout out to Lucasfilms. Hopefully we don't get involved in any lawsuits or something like that, but I'd settle with a nice cease and desist letter from Lucasfilms, just for being in full transparency there. But this gives us time to build that body of work, and a big part of it is creating a structure within our local government, very much like our community councils that help to help advise and align this really broad scope of work that our communities are already engaging in.
Well, I would like the opportunity to introduce you to our community, just so that people are aware of what you have to offer, because East Missoula is a very diverse community. We're more on the low income end of things, so we've got a wide scope of folks out here who there may be a lot of folks who could use your services or maybe even participate and assist you. I don't know. But it would be great if you could put a little presentation together and just introduce yourself to our council so that we're aware of you and aware of your resource that you have available for everyone.
Thanks, Lee. Jamar, if you could do us a favor and before we adjourn tonight, put your email address in the chat for folks who, whether it's Lee or others who might want to reach out to you. Emily?
Yeah, I'm just gonna hit a broad question, and I probably know the answer, but I definitely want to just kind of hear it from a standpoint that isn't in my own head, which is, what is the hurt in Missoula County that is happening that you see, and what kind? I'm assuming you're trying to bridge a problem and try to understand or try to bridge a problem. That's my assumption, and so I just want to kind of hear it from you on, what was why was this developed? Where's the hurt, and where are we going with it? Does that answer? Does that make sense?
It doesn't, and Emily, I just want to make sure, and sorry, my children are having lots of fun in the background. But Emily, did I hear you correctly? Is it HURT, H-U-R-T?
Yeah, kind of like hurt or problem, or like, the hurt that's happening in the community, or, I think of it as a lot of times healthcare. So it comes out as hurt. So does that make sense? Kind of a broad term for hurt, problem, inequity.
Thanks.
Yeah, absolutely. I think that the hurt is that we're all hurting, and to some extent. And one of the challenges that our hurts are occurring at the intersection of a lot of the identities that we carry. We can look anywhere and examine the sort of social inequities that are contributing to that hurt. I'm certainly not going to shy away from talking about like the isms and those sort of things, but I think some of the things that are important to contextualize is that as we this work gains like sort of national attention, me having a role is sort of indicative of a sort of national envisioning or addressing of some of these systemic inequalities. I think it's really important for us to be able to examine where we are within the context of those social inequities. Certainly here in Missoula, class is a really large issue. And our class in economics are really large issues that impact our functionality. It impacts our health outcomes. It affects our socioeconomic outcomes. It affects our educational outcomes. And these systems are all sort of tied together. And I think that as we look to other communities and see what they're doing, we recognize that these communities don't look like us. They don't operate like we do. And so one of the things I'm really excited about my role is being able to help really define and articulate those problems in a really Missoula County centered way.
Thanks, Jamar. Thanks, Emily. Other questions for Jamar? All right, I see your email address in the chat, Jamar. So folks on the line here, if you want to snag that before you leave tonight, and if any other community councils beyond East Missoula would like to get Jamar on your agenda, feel free to reach out directly to him.
Thank you, Jamar.
All right. Tom, did I see your hand up earlier, or maybe not?
No.
Oh, okay. Were you brewing some coffee back there? I couldn't tell.
Well, actually, to be honest, I was pouring a glass of white wine. In fact, I got so excited about the wine, I think I dropped myself out of the meeting, but I'm back again.
That's okay. I was getting thirsty watching whatever you're doing there. So thanks so much. Violet, do you want to just do a little round robin here with the community councils who are represented? Maybe call out the specific community councils, and we can see if they have anything to share with us this evening.
Do we have a Cofield update? Am I looking at a?
I think that was the last agenda.
Never mind. Okay.
But I could
you want to stand in for Sarah Kofeld and describe what you're looking at out your window, which I suspect might be smoke.
Quite smoky. So hope everyone has their air filters, their fans and their HEPA filters.
Well, you know what, on that front, before we go around the table here, so to speak, the virtual table, I did finally get with the program. Since our home does not have central air conditioning and we rely on opening windows at night, we finally did break down and retrofit one of these box fans with an air filter, and it really does work. So go get those high capacity air filters at Ace Hardware or whatever, and tape it onto the back of your box fan and put it in the window, and it's better than nothing. Okay, with that, Violet.
Yeah, let me just run through the community councils that I see are represented on the call. If I call your name, if you just want to give a brief update about what's going on in your neck of Missoula County, and if you have any other questions or anything to ask, you can totally do so. We have a few folks, as was mentioned, representing from Bonner Milltown Community Council. Do you guys want to take it away?
You got anything, Emily?
I've said enough tonight. I'm good.
Rick?
I just wanted to say that I attended the outreach from Planning and Zoning on the new Planning and Zoning regulations update that was here at Hellgate Lions Park. And it was an excellent presentation, very thorough. As you know, I've got a big planning and zoning background. I think they're heading down the right path, and I hope more people get out there and see what they're working on. So,
thanks, Rick. Appreciate that.
Okay, and that leaves me. I went to the trails meeting this afternoon or at noon today, and I think the proposal that they're working on is good, and I think the process is good. They had maps of the entire county. They had already presented in one place, and Browder, I think, probably was just at another one that finished before this meeting started up in Sealy. They're doing some good work, and I think we need to pay attention to what we do with trails. I know money's kind of tight, but we can always, I think, use more trails and more bike and pedestrian opportunities. The other thing is the repository that's out here in the wonderful world of Bonner Mill is about 70 to 75% removed. And so that'll free up some space for Steve and Mike to put more manufacturing or operations of some sort in the area. My one gripe there is out of the 500 people working in Bonner now, there's only 20 of them that live in the Bonner area. So it's not doing us a lot of good. And of course, you wonderful commissioners are getting all the tax money out of it. Bonner's not getting much yet because the incremental goes into TIF. We'll see how that works out. I think it'll work out fine. But we were talking earlier about getting more people involved and getting more information out for the vaccines. If you look around here, we've got 3 councils out of 7 that have been steadily coming to these monthly meetings. And I tell you that the Bonner Council in particular, I'm sure Lee will follow this, and Tom also. These are good meetings, and we enjoy them, and we get a lot out of them. And whoever's putting the agendas together is doing a good job and providing us with a lot of information. We need to find a way to get the other active councils, and I know a couple of them are not active, but we need to do more outreach to get the other active councils involved in this meeting. It's good interchange between all the council members. So that's all I've got.
Thanks, Bert. Appreciate that. And just a shout out to, and both Rick and Bert mentioned some of our good staff work going behind the scenes and sometimes in front of the scenes by way of Parks, Trails, and Open Lands and our zoning and planning staff. But just a shout out to all of those county employees. And not, how could I forget our administrative staff, such as Violet, who do an excellent job orchestrating these and many other meetings. Thank you. Chet.
Yeah, thanks, Dave. I appreciate your comments about staff, and yeah, kudos, Violet. She's always hurting us to get those agenda items pulled together. Since I honestly did not pay Rick or Bert to mention the two things I was going to make sure I mentioned, I'll just add a couple of quick things, and I appreciate both of you for attending those meetings, because it's great to have you involved, and it's good feedback too to hear how you thought they went. I will post the links in the chat for both the Missoula County zoning update. Many of you probably got a postcard that looks something like this in the mail and have seen some of the other outreach. So there's information on that as well. But just to give you another link to share, I'll post that. And then on the trails planning that Bert mentioned, they've been out fast and furious this week in communities. So Lolo, I think they were out in the Frenchtown area, Seeley's tonight, and I'm missing a couple other meetings, but there's been a lot of them. There's also a story map with a survey, and so I'll put that link in the chat as well. So for folks who weren't able to make it out there to one of those sessions on the trails planning, this is another way for you to engage in a link and some additional information around. And I also appreciate the emphasis on trails, Bert. I think this will help us have a vision for the future and make sure we're plugging into projects that are upcoming when we have trails opportunities to connect our community. So again, appreciate all of the efforts out there and attendance at these, and feel free to reach out to us if you have any questions.
Thanks, Chet. All right, thanks, Bonner Milltown. Go ahead, Violet.
Yeah, I will go next to East Missoula. Lee, any updates from East Missoula?
Yes. For one, I would like to thank Chet for putting together those programs. I have posted them. I often follow Bert's lead. I've got them posted on our East Missoula Community Council page for the trails, and I think that's very important. But right now, I'm personally involved in an emergency dog rescue, and it's taking up my time, so I'm not able to participate, but I am able to transfer that information. And I see on our Facebook page that we're getting a whole lot of response to that. A lot of people checking on that. So I'm hoping that East Missoula is turning out in a big way to support and have a voice in that. I think those trails are important. The other thing is the zoning. We are right on top of wanting to be very much a part of that, and we will be part of that. I will personally be part of that. In the summertime, our community council does not meet in June, July, and August, so right now we don't meet again until September. However, we've got some really important issues going on right now with a whole bunch of areas in our community. This zoning is particularly a hot spot, so we are paying close attention, and I'm going to have to dig in to some government stuff. And I know that there's stuff that circumvents going through the commissioners, so I'm going to have to go straight to the Public Works to find out some information on some stuff, and I will be doing that. So thank you for all the work everybody's been doing. I love the way the zoning, his planning and program has been coordinated. You guys have done a fantastic job. We've all worked really hard at getting those zoning designations. We've got a real important one coming out here in East Missoula that we created out here, and we're really proud of. It's the Live Make zoning designation. So that's why I will be very closely involved with this all the way to the end. I want to see it through to the end. So thank you very much. And again, we don't meet till September, so unfortunately.
Thanks, Lee. We have, I believe, West Valley Community Council. Tom Tucker's on the call. Tom, any updates from West Valley?
Well, nothing other than we still cannot get into the fire hall to meet for our meetings. They're full of firefighters. So we're going to, I mean, I've been monitoring these things all summer, your meetings. So we have a new member, which we will bring on board in September when we meet. Looks like we're going to have to borrow one of the rooms over at the junior high school to start meeting there, and we're still looking for another board member. But other than that, the smoke out here is just killing us, and things are kind of tough to get around on. So hope everybody prays for rain. We need it. Get these fires put out. So other than that, we're just biding our time. That's it.
Thanks, Tom. Last community council that I see is Sealy. Tom Browder, any updates?
Well, I have a couple. I mean, initially, I want to echo what Bert said about the value of these meetings. I mean, it's really helped us, just the contacts, folks like Chet and people in his department, and the health updates. You know, we've just some little things like our pedestrian trail getting swept, which it hadn't for years, that really make a difference to a small community like this. So the meetings are great. Hope we can continue them. We did have, as some of you probably know, and this is another example of how the rural parts of the county, I think, stick together. We had a fire in town that burned up a house and a couple of trailers and some vehicles. And it was pretty iffy last Thursday because it was in the 90s and a pretty strong wind. But we ended up having help from Potomac. They sent an engine. Swan Valley Condon sent an engine. Lee, your folks in East Missoula sent an engine. DNRC from the state and the Forest Service. And it really took all of that to contain what was blowing embers all over downtown Sealy Lake. It was just nice to see that was just without question, one of the communities had a need, so we took care of it. I guess the one thing that we'd just like to make sure we get, since the mandates that we used to live by from the health department, like with our visitor center, our community foundation, you know, when we wear masks, you know, just how we behave, I guess you can't do, or you know, we know where that is right now. But if we could get some maybe pushed out notifications to council members, if Cindy, like if you come up with a major recommendation or something, because it just seems like it's communications, maybe not any of our fault, but just because we can't do what we once did. And we have an elderly population up here, and I think I have no idea what our share of non-vaccinated people is, but I think it's higher than we would like. So yeah, if the council members and our local paper, the Pathfinder, just make sure we get updated on, you know, trends in the numbers, trends in the age, in the demographics, whatever. I think that'll help us just keep on top of things. So that's it.
Thanks, Tom.
Thanks, Tom. Did I miss anybody out there, or does anybody have anything else they want to ask or share?
Lee.
Hi. Thank you. I just thought of something. We have an alternate who has applied for that post, and I'm unfamiliar now with how I go about when we do start back up in September. Is there a way to get her onto our board as an alternate? I mean, is there some kind of a formality or a oath or a process or something? How do I do that? Do I just say she's in, or do we take a vote, or how does that happen? Have we figured that out yet?
So Lee, this is someone who we have already, who the Board of County Commissioners appointed as an alternate, or? I'm
Well,
not exactly understanding what the situation is.
Sue Holden said she applied. So, since I'm not privy to stuff that goes from one individual to your office, I don't know if you guys got paperwork from her or not, but she said she applied for that. So I have you ever heard the name Sue Holden before? And does she have to be approved by you guys first, or how does that work?
Well, the way the process works, I think, as we all know, community council representatives are actually elected positions, but it's a rare day that, for a variety of reasons, that folks actually get their names on the ballot for such things. So the Board of County Commissioners typically ends up interviewing applicants and then appointing someone. So I don't know where this stands in the queue. Violet, do you have any idea of this?
I was just going to say, Kyla is the other admin in the commissioner's office. She deals and knows a lot more about appointments to boards and councils than I do. And I will, I'll ask this question to her and loop you in, Lee, just so we can see where we're at in that process.
Okay, because if Sue Holden does not have the correct paperwork filed with you guys, I need to get on top of her, because she's been consistent at our meetings and she's definitely wanting to be the alternate. So nobody else has shown any interest at all. It's one of those shoe-ins rather than a vote type of thing. So I just need to know how to make that nice and smooth, and hopefully be able to swear her in at our next meeting, at our first meeting in September. So.
And on that front, Lee, I know that I have personally sworn in community council members, and I can't recall the last time we did such a thing, but I think we would be happy to come out to East Missoula or do it virtually or however.
Yeah, Zoom. We're on Zoom because
Yeah.
like what was it? Maybe whoever said that they don't have their fire hall for their meetings, we don't either. So we're on Zoom.
Okay,
And
thanks.
we'll remain on Zoom until the pandemic is under control. Who knows? So.
Okay, we'll get it figured out with Kyla tomorrow or whenever she's back
Great.
in the office.
Great. Thank you so much. I appreciate that. That was just one of those off the top of the thing that I know I've got on my agenda for September and didn't quite know how to approach that one. I want to do it correctly. And I don't, since it's all new to all of us, I don't know who's done it yet and how they've done it. So I wanted to find out.
Thanks, Lee. Bert? Bert, you're muted.
Well, I'm not supposed to be. I don't know who did that. Oh, anyway, for Lee, it's an elected position. It's going to be handled just exactly like your position and my position were handled, I'm sure, all the way down the line. The other one is one of the people that we've missed over a period of time, and I wanted to say thank you to, is Sarah Bell. She's done a good job for us over time, and I hope she's continuing to do a good job for you commissioners. But I appreciated her immensely across the board.
We can't get through a day without her.
Yep. She's
absolutely
still doing great work with our communication staff.
Good. Good to know. Thank you.
You bet. Okay, anything else from anyone? We've managed to burn through an entire hour. Mr. Slotnick, you just appeared. Does that signal you want to say something?
I've been here. I was just chopping and cooking, and I thought we were coming to the end, so I'd make an appearance. I do want to echo what you said. Sarah Bell has rock star status in our little world.
Yep.
Josh, would you give me a call when you get a chance? This is Bert.
Yeah, you bet.
Oh boy,
Absolutely.
Get taken out to the Caldwell woodshed.
We're overdue for lunch. I'd love that. Maybe we can do it next week.
Let's look at it.
Okay.
All right. Well, unless there is anything else from anyone, we will be adjourned tonight. Oh, Josh.
Emily, I was just going to say, my wife walked by and said to make sure and say hi to Emily, who she knows from hockey. So I'm saying hi from Kim. There you go.
Hi, Kim. Can't wait till the winter starts.
Okay.
Yeah, I think she's thinking the same thing.
All right. Keep cool, everyone. We'll see you next month.
Bye.
Thank you.
Thanks, everyone.
Thanks, everyone.